Hi, this is Jennifer. This week I'm 15 weeks. Um, I've been really tired and I've been feeling a lot better because I've been getting a lot done. I've been making a lot of plans for the baby shower. Don't know exactly where we're going to have it, but it's probably going to be like at a hotel or something like that. And what I've been doing is collecting addresses because I like when things are mailed to me. So I would prefer to mail mine. So I've been collecting addresses because that's very time consuming. Like some people's address I looked up on the internet. Then when I go places, sometimes I carry my address book that's in my purse and have people fill that out. So it's a little bit time consuming. Then I have to rewrite them in my book when I get home. So yeah, I've been having a lot of skin sensitivity because I think they said I had psoriasis before I got pregnant, and they gave me some steroid cream, and you can't take that when you're pregnant. So what I've been using is Aquaphor. It's like a Vaseline type of cream, and that's been helping a lot. Like now, like my neck was real broke out, and finally it's starting to heal. My hair seems to be shedding a lot. I don't know if that's because I put some color in it or I don't know. I want to just tell people that earlypregnancytest.com is having a really good sale. And then I went to the eye doctor and they said that I have some condition with my eyes, so I don't know if I'm going to be able to wear my contacts anymore. And let me see. I went to the emergency room because I had this headache. It wouldn't go away because I've been having a lot of headaches. And this headache was really severe, and I just couldn't take it anymore. I think it had been 2 or 3 days with the same headache, taking Tylenol, taking this, taking that, and it still didn't go away. Because they had told me at the I had went to my midwife. She said try a cup of coffee and Tylenol, because that usually does it. And so I tried that for like 2 or 3 days, and that didn't work. So then I went to the emergency room and they said I had a sinus infection, so they gave me some antibiotics and some pain medicine that I could take when I'm pregnant. And so it seems to have cleared up. I still have a little bit of congestion, and so this is a new doctor for this pregnancy, because before my old doctor, he doesn't deliver babies anymore. So, but I really like the new doctor's office. Like, anytime I go there, I always have a list of questions. So they answer every question, and I really like the doctor's office. Because I was asking her about, because I have really painful gas pains in my stomach, and so she said that the fiber should help with that, and drinking a lot of water. And then she said the pelvic pain that I keep having, that's pretty normal. And I've been having some nerve pain, like sciatic nerve in my behind and going down my leg. And I had that with my daughter, and it's very painful. It feels like your leg's going to give out. And so she said that's all normal because of the stretching and everything. But she said when you're pregnant with your second child, things start to happen a little bit earlier. Because when I was pregnant with my daughter, I don't remember having nerve pain until like the end of the pregnancy. And then I asked her about the cysts, because I have 2 cysts. And I wonder when I start to feel the baby move, is it going to be painful? And she said that most of the cysts dissolve, so it shouldn't be a problem. And when I went to the doctor, my midwife, to follow up from the emergency room visit, they let me hear the heartbeat again. The last couple times they tried to get the heartbeat, the baby was moving so much they couldn't get it. But this time I don't think I had drunk anything with sugar in it, so they were able to count the baby's heartbeat. It was 160. There's a lot of old wives' tales about if it's this, it's a girl, if it's that, a boy, and that's usually only right sometimes. So I just, next Friday, on February 4th, I find out what I'm having. So I'll probably do an extra video to let you know. Well, Friday's my regular day doing videos, but I don't know, I might do it Friday or Saturday depending on how busy I get, because I would like to finish some of my registries and stuff, because I registered at 3 stores, so I want to finish registering, because when you know what it is, it's easier to register things. And then also I want to talk about birth plans. I really don't make a birth plan. Like with my daughter, I didn't make a birth plan. The only decision that I decided was that I was going to have an epidural, because I'm not a person that likes a lot of pain, so I knew that if you get the epidural, that gives you strength and able to endure, you know, no matter how many long hours it is or whatever. But I only had a 5-hour delivery with my daughter, 5-hour labor, so it wasn't too bad. But the epidural did help me push her out. I pushed her out real easy and real quick. So that's the only birth plan that I always do, because since I've had a child, I'm not naive. Like some people, when it's their first child, they're all naive, thinking, oh, I have all these decisions. But really, that when you're in labor, it's really critical, because once your water breaks, they have so many hours to get that baby out. And if things don't move along like it's supposed to, you're going to get a C-section. So you can make all the birth plans you want, but really it's up to, you know, God to see, you know, how you're going to deliver. So, because with my daughter, they thought I might have to have a C-section, but I ended up delivering her vaginally. So, but I had never put any I didn't really upset myself to the point where I have to have a vaginal delivery. And because I think that's kind of unfair to yourself, because you don't really know, in that it could be an emergency situation, you don't know what's going to happen. So yeah, and the baby just might be too big to go that way. So I always just try and be open-minded and just try and pray that I have a healthy baby. I don't really care how it comes out, just as long as me and the baby are still in one piece. Because like after my delivery, they had trouble stopping my uterus from I think it wouldn't contract, so I was still bleeding. So I thought I was going to get a hysterectomy, but thankfully they were able to massage my uterus and get it to stop bleeding. So I try and just try and be positive and just say, you know, whatever happens, I'll be happy with that as long as me and the baby are safe. And that's all that I can ask God for. Because I can't ask God for a perfect delivery, because that's not, you know what I'm saying, that's just not how things work out, you know what I'm saying. The situation could change, you know. So, because if that baby's heartbeat starts to drop or whatever, they're going to get that baby out very quickly. Or if the cord is wrapped around his neck, then they're going to do what they got to do. And that's what I hope they do, you know, because I want my baby, and I want them to do what they have to do. So I'm pretty much, you know, vaginal delivery is a little bit easier to heal from, but if I have to have a C-section, that's just what has to happen. So that's pretty much my birthing plan. Yeah, so I think that's all I have to talk about. Yeah, so I'm doing well. I really, since I have next Friday to find out what I'm having, I hope that week goes very quickly so that I can find out. I'm going to try and remain calm. But I'm just gonna, you know, because me and my husband would like a boy, but my daughter would like a girl. And I'm kind of indifferent. I love girls because I have a girl, and they're really easy to shop for. But I would like to experience a boy because, you know, it'd be a whole different experience. And it seems like their clothes are a little bit harder to find. I mean, because everywhere you go, for boys' clothes, they have casual clothes. And I'm more of a... like, I go to a lot of places where we have to be dressed up. I would have to probably go online and go to different stores and talk to different people to find out where I could get suits and nice clothes, because I'm not one of those parents that lets my baby walk around with bare feet or anything like that. My baby has socks, shoes, you know, the whole accessory, all the accessories. So, you know, that's just how I am. So I think I would just have a little more challenge of finding places where I could get cute stuff, because I like casual stuff is okay, but sometimes I want the baby to look really nice and polished. So yeah, but I'm excited. No matter what it is, I'll be happy, because this is a miracle, and I never thought that I would be able to have one child, not alone two. So I'm just really blessed, and I just kind of take it easy and let things come as they may, and just hope that this pregnancy goes well and that my baby makes it to full term like my last baby. Because I had a niece that was premature, and she spent a lot of months in the I think it's called NICU. So it was a little bit hard, because they have all those tubes coming out of them and stuff, and it's really painful. So and then you don't really know if the baby's gonna make it or not. So I just pray that to have a successful pregnancy and a successful delivery, no matter how the baby comes out, and a healthy baby too, and that I'm in one piece too. I want to tell everybody to comment, rate, and subscribe, and I want to wish baby dust to all the people out there trying, and never give up on your dreams. And send sticky vibes to all the newly pregnant people. Okay, that's it. Thank you. Oh yeah, I wanted to show you my stomach. I'm still not showing that much. So this is like a side view. I mean, I'm starting to get a stomach, but I'm still look really little. And I wanted to show you, I got a glider, secondhand, and I cleaned it, and it's got a, this is the baby's room. I brought a couple items, like I got this, let me show it to you. It's like a wall hanging, I got that. And I really like that, because it's different. And let me see what else. Oh yeah, and this is just the stuff that I have so far from the baby. I think I showed you the car seat. If it's a girl, I'm probably going to take it back and get something else, because let me see if I can show it to you. That's what it looks like. It's like brown and red. So yeah. And I got something else to say. I forgot to say that I've already made plans to get rid of this furniture that's in my office and make this the baby's room. I have a charity organization, Volunteers of America. They're coming to pick up all the furniture, and we can take it off our taxes. Then I'm going to start buying like the crib, the changing table, the dresser. I want a white bookcase. All her furniture, all the baby's furniture is going to be white, because I'm using the yellow, the pastel yellow Winnie the Pooh stuff. So all the baby's furniture is going to be white, and also my glider is white, so I want everything to match. But I will show you the nursery as soon as I get done with it. Thank you. Bye-bye.